Welcome back, everyone. I'm excited to introduce our next set of presenters. First up is Dr. Nicole Nicely, Professor of Internal Medicine at the University of Iowa. Dr. Nicely developed and now directs the University of Iowa LGBTQ Clinic with Dr. Katie Mborick, which serves about 4,500 LGBTQ identified people per year. Dr. Nicely, who is also the co-director of the Anal Dysplasia Clinic, will speak to us about the Anal PAP program at UIHC. Dr. Nicely?
Hello, I'm Dr. Nicely. I am a professor at the University of Iowa LGBTQ Clinic in Internal Medicine and General Internal Medicine. I'd like to tell you about anal dysplasia screening. I am the co-director of the LGBTQ Clinic and co-director of the anal dysplasia screening. So why is that important to screen for anal dysplasia? Some populations are at a very increased risk of anal infection with the human papillomavirus. As you know, the human papillomavirus can cause dysplasia and increase the risk of cancer in many parts of the body. So some people are at increased risk, and these are some of the people with HIV of all genders, people who practice unprotected anal sex. In particular, folks that are older than 40, those are the folks that we target for screening. People that have cervical or vaginal human papillomavirus dysplasia, or other abnormalities of the PAP test, for example, atypical squamous cell of unknown significance related to HPV, or dysplasia. And again, we're targeting a population that is older than 40. People that are immune suppressed of all genders and all sexual orientations, regardless of practice of anal sex. For example, solid organ transplant people, people with hematological malignancies, people that are receiving anti-TNF treatment, people with autoimmune disorders such as lupus and rheumatoid arthritis and others. So we are recommending that those people should be the high-risk population that we're targeting for anal dysplasia screening. As you can see here, there is a significant risk for certain groups for cancer. In particular, if you are a man who has sex with men and you have also positive anal HPV and you are HIV positive, the risk is tremendous, is quite significant when it comes to cancer risk. If you look at what the procedure looks like, it's a procedure that is very simple, and you can perform that in your office if you would like. If you feel like this is not a procedure that you would like to perform in the office, you can refer the patient for screening at the anal dysplasia screening program at the University of Iowa. So how would you screen the patient? First, you want to place an order, which is called an anal PAP order. And you also want to, at the same time, place a human papillomavirus order. So at the University of Iowa, at our electronic medical records, which is EPIC, we have a order set that comes with both of them together. The patient will be in the lateral decubitus, and their back is facing towards you. We're going to use a rayon swab. So it's the swab that has the best success rate. So we don't want to use a cotton swab, and we do not want to use the brush that we typically use for anal PAP. So we want to use the rayon swab, and the swab is moistened and introduced through the anus and rotated in the dentate line. So you want to go right past the sphincter. So when you introduce to the anus, you're going to feel like the swab is going through the sphincter, and right at that point, you're going to rotate it about 4 or 5 times. You want to place a little pressure on the swab so that you're not simply collecting stools, you're going to allow the swab to touch the mucosa and rotate it. Once you're done, you remove the swab. You're going to break the top part of that and place in the liquid PAP container, just like you do with a PAP brush. So in order to find this order set on Epic, you can then choose multiple options. One option is to order the Pap smear, the anal Pap, along with the HPV. Another option would be to select refer to the anal dysplasia clinic. The third option, if you completed a Pap locally and your Pap is abnormal, I will then suggest that you refer directly to the high resolution endoscopy clinic. But again, remember that option is only if you have already completed a Pap test. Now, of course, if you find a tumor, then this would go to the colorectal surgery. Now, small masses, they're HPV related, for example, can be sent and treated at the anal dysplasia clinic. So I'll show you what the order set looks like. So here on the top option, you can simply choose the anal Pap. Down below, you would see the high resolution endoscopy. And if you prefer to have our team complete the Pap test, you can refer to the anal dysplasia screening clinic. And finally, if you are concerned about a tumor, it would go to the Department of Surgery. Now, condyloma, which we typically previously would send to the surgical department, now we can treat that in the anal dysplasia clinic at the high resolution endoscopy setting, which can actually see those lesions very well in probably a much higher resolution than if they were being done at the Department of Surgery that does not have access to the high resolution endoscopy. So how to prepare? The first thing is to make sure we do a little bit of a trigger warning. Tell the patient that they will be undressed and they will be, we will be performing the procedure in the anus. They will have their back towards us. Again, we want to make sure people are not surprised and feeling uncomfortable. About 24 hours prior to the anal Pap, we want to avoid any sort of receptive anal intercourse, any applications of lubricants, medications, any sex toys, or enemas. Now here, it allows you to see where we're going to be collecting the specimen from. You can see here the dentate line, so that would be right, as you pass through the sphincter, and you're going to collect in that area right immediately after that, or above that section. So we have seen some folks that collected the anal Pap on the external portion of the anus or did not penetrate through the sphincter, and often we do not have adequate materials for that. I also want to remember that we want to moisten the swab before you complete the anal Pap, as it would be very uncomfortable to use a dry swab. So this is what it would look like. The patient would be on their lateral decubitus. You will complete the swab, and then you apply, you break the tip and put it inside the anal Pap liquid medium. Now you can see here in the high resolution endoscopy what it might look like as we are performing the actual procedure. It would be similar to a colposcopy of the cervix, except that this is done with the same type of equipment and a very similar technique in the anal area. So again, our procedure is completed by a gastroenterologist that has been trained on high resolution endoscopy. So here are some examples of what you might find upon completing the anal Pap. For example, you can find a typical squamous cell of unknown significance with a negative HPV. So our recommendation is to repeat in 1 year. If you have a atypical squamous cell with positive HPV, we would refer to high resolution endoscopy. If you find any dysplasia with high resolution endoscopy, whether it's low grade or high grade dysplasia, you would again refer to the high resolution endoscopy. Some abnormalities can be treated there, and often most abnormalities can be treated in the high resolution endoscopy procedure. If you find a mass and you're not sure what that might be, you can also refer to the high resolution endoscopy. For example, we often find condylomas in that setting where you can feel a small but firm mass and that you can send to Dr. Levin for biopsy. Now, if you are concerned about a larger tumor, or if you're concerned about cancer, then I would refer to colorectal surgery. So this area is a new area in healthcare. So we're trying to determine if performing high-resolution endoscopies and anal PAPs in these high-risk populations will improve outcomes. So the ANCHOR study is looking at the guidelines. We are currently following the guidelines that we talked about. So people that are in those populations that have high risk at an age of 40 and older, but we are currently trying to determine, is 40 the correct age? Should we be only doing this for people that have HIV? Should we be doing those for people that have the other high risk conditions? And then we're going to be looking at the outcomes research from a large group of investigators throughout the country and abroad, identifying anal PAPs in various populations and collecting data long term. Now here, you will see how to refer to our clinic. So if you prefer to have the anal PAP completed at the anal dysplasia clinic, you can call that number and refer for anal PAP. If you already completed an anal PAP and you found one of the abnormalities that would require a high resolution endoscopy, then you will refer to the high resolution endoscopy clinic. And this central number is the scheduling number. So what else can we do to prevent human papilloma virus related disease? So we would like to make sure that people are immunized, and offering the human papilloma virus vaccine for people that are eligible. For example, in the United States, we're using an age up to 45. And this is an expanded age that has changed recently. So anyone of any sexual orientation, gender identity, please offer the opportunity for people to be vaccinated for the human papilloma virus. In particular, you want to target minority groups that have a worse outcome from human papilloma virus related disease, in particular cancer. So people that identify as Black or Latinx, Native American, Native Alaskan, Native Hawaiian, and Pacific Islanders would be the highest risk group. You also want to specifically target LGBTQ identified people of all identities. It's important to remember that not everyone will disclose anal sex. And also, if you do not ask if people practice anal sex regularly, they will not disclose that to you voluntarily. So you want to offer the opportunity for people of all genders to self-identify as being at risk by completing a comprehensive and inclusive sexual history for people of all identities on a regular basis on an yearly exam. Now, in Australia and some other countries, there are no age limit to immunize. This is considered a universal immunization. Their goal is to eradicate human papillomavirus disease. So some of my patients that are older than 45 will ask, can I be immunized? In particular, people that are at higher risk for HPV-related disease of the anus, also people that might have dysplasia and say, would that help potentially? Can I be immunized if I am outside of the CDC recommended age in the United States? The answer is yes. And the only caveat is that most insurances will not cover if people are outside of the CDC age groups for human papillomavirus. So if they're older than 45, they likely will have to pay out of pocket. Other things to discuss, including the use of condoms regularly. For example, vaginal condoms can be used for anal sex, and they often are safer. They're less likely to rupture, less likely to be accidentally removed during sexual intercourse, because they do have a ring on the outside that covers the anal area. And so it further protects the anus as well as both partners in the anal sex activity. So I would encourage people to regularly talk to your patients, regardless of your knowledge of their sexual orientation or gender identity, and specifically be more inclusive when you talk about safe sex strategies to make sure that we include anal sex. It is important to know that many people that do not identify as gay or in the LGBTQ community may practice anal sex regularly. For example, younger people may consider anal sex as safer, as it decreases the risk of pregnancy, for example. But they are experiencing higher risk sexual activity that can increase the risk of HIV. And besides the opportunity to screen for HPV, that's also a great opportunity to talk about higher risk sexual activity and prevention of HIV, as well as screening for other sexually transmitted infections like gonorrhea and chlamydia, in particular for oral and anal gonorrhea and chlamydia that may be entirely asymptomatic. So with that, thank you very much for listening, and I hope that you can incorporate these practices in your primary care and other practice. Thank you.
Thank you, Dr. Nicely. And Dr. Nicely is live with us right now, joining us now for questions. How are you?
I am doing great. It's always, I find that always challenging to listen to oneself speaking, but it is great to be here. And thank you so much. I got many comments there, and I appreciate all the lovely comments that I received.
Awesome. It's always nice to have you with us. You know, I'm very grateful for this conference that so many of my favorite people are joining us today, and Dr. Nicely is certainly one of my favorites over at the university. I actually learned how to do a lot of the just basic conversations of talking to patients about sensitive subjects by going to Dr. Nicely's clinic and sitting down and watching her have these very detailed and sensitive conversations with patients. And you watch someone do it a couple times and you say, okay, now I got it. You just hear the words that someone uses, and they're subtle words, but very important words. So I appreciate you as always. I have a couple of questions for you, Dr. Nicely. The first one is this. And let's say I'm in primary care. Should I perform anal paps on all of my patients who are immune suppressed, regardless of sexual orientation?
Yes, that is what I do. I have several patients that I have identified that are immune suppressed that do not identify as having anal sex. And I have specifically asked, and I have identified not only HPV, high risk HPV, but also dysplasia. These patients ended up getting a high resolution endoscopy. Many of the patients that are immune suppressed, you might end up seeing HPV disease, for example, in the skin. You see people that have, many warts related to HPV. So I would absolutely screen for that, not only vaginally, but also anal paps regularly. And people that are sex assigned at birth male as well, whether or not they identify as having anal sex. So anybody who's immune suppressed, especially people older than 40, and especially minority populations.
Awesome, thank you. And one more question coming your way. What are the other patient risk factors for developing anal dysplasia?
So the anal dysplasia, has immune suppression is one of the big ones. And I think HIV is the top one that we should be always, if your patient has HIV, regardless of their sexual orientation or gender identity, that is probably the one top population that we need to target. In fact, most of the anal dysplasia clinics are centered around the HIV clinic. However, we have identified other patients that could be at risk and the immune suppressed people from other conditions as well. I would say that honestly, regular anal sex and having multiple sexual partners would be one of the biggest risks. So if we don't ask, like we talked about, if people practice anal sex regularly, that would be one part of the sexuality that will be missed. And honestly, patients feel very comfortable telling you if you feel comfortable asking. So people feel actually a great sense of safety when you ask them very detailed questions. And I hear that again and again, that people feel like a sense of relief. Oh my goodness, I can talk to you about this. I have questions on that. And so if you ask them, you open a door. So always try to use very open questions. For example, do you do anal sex, oral sex, vaginal sex? Do you use sex toys? You share, kind of leave like a big long line. And then in there, people might say yes to any of that. So those are opportunities for you to kind of invite people to share and identify people that are high risk.
Perfect. And one more question coming your way. If someone has already tested positive for HPV through PAP, should they still try to get the HPV vaccine?
Absolutely. I've seen people actually resolve their HPV. Most people, as you know, that's the reason that we don't do HPV screening for PAPs in 18-year-olds, 19-year-olds, et cetera. We only do that if the PAP is abnormal, right? So we don't do that because many of them will have HPV, right? So they're sexually active, they're in with multiple partners at the time, think college and so on. And so they will get HPV clear, right? So that's part of the vaccine benefit is helping you get that immune response so you can clear those HPV infections. When you see people with persistent HPV that become chronic, that's when you end up seeing the risk of cancer increasing. And so getting the vaccine, I think would be super helpful to help people clear some chronic HPV infection that they are experiencing.
Thank you, Dr. Nicely. That was really great, just great information for us to have.